NACCHO supports the use of Healthy People 2020 among our members, the 2,700 local health departments across the country, and also hospitals and other organizations. In this project, we emphasize its use in community health assessment and community health improvement planning processes in identifying objectives, targets, and strategies. You may have heard of NACCHO's assessment and planning process, Mobilizing for Action Through Planning and Partnerships, or MAP. Within the MAP framework, we describe ways that Healthy People 2020 can be incorporated. Our major activities include identifying barriers and challenges to the local use of Healthy People, assessing its uptake at the local level, and sharing examples of local use. We also promote the use of Healthy People through webinars and other means, and we offer training and technical assistance on the use of Healthy People for assessment and planning purposes. All of our efforts are designed to encourage collaborative and community participatory approaches. On this slide, you will see a screenshot of our website. Let me point out a few of its features. There are 3 tabs: LHDs, or local health departments using Healthy People, community benefit, and resources. Clicking on the first tab will bring you to a page where we have started to post links to community health assessments and community health improvement planning documents using Healthy People. Also on the page, we have a link to the Mobilizing for Action Through Planning and Partnerships social network site. This particular link leads within the social network site to a list of MAP assessment and planning documents. We have included the Healthy People icon next to plans which use Healthy People extensively. By the way, you are invited and welcome to join the MAP social network site. Clicking on the second tab will bring you to the community benefit page, where we have posted a couple of Healthy People related resources for local health departments and hospital collaborations. It also includes a link to NACCHO's in-depth coverage of community benefit and its implications for local public health. Clicking on the third tab brings you to a set of Healthy People related resources, including webinars, videos, and reports, and links to other NACCHO programs that are also working on community health assessment and improvement planning. All of these are open access materials. My email address is posted on each tab, and I would be glad to receive your emails and your comments about how you're using Healthy People in your work, and also any questions or ideas you may have for NACCHO. The Healthy People 2020 NACCHO partnership is in its second year. It has been enhanced by 2 concurrent developments. First, for local health departments, a voluntary national accreditation program has begun. Second, for nonprofit hospitals, community benefit requirements have been strengthened. Both of these have really taken off within the last year or so. For accreditation, local health departments must have a community health assessment and a community health improvement plan based in a collaborative process. In the accreditation guidance, Healthy People 2020 is named as a resource for the development of these components. For community benefits, hospitals must develop a community health needs assessment. This is nonprofit hospitals, a community health needs assessment which takes into account the broad interests of the community and includes input from public health. Local assessment and planning activities have been enhanced by these concurrent developments. We are hearing from local health departments that a synergy is developing between health departments and hospitals, since both need to conduct these assessment and planning activities. As the local health department in Montana said to us, it was good timing. The priorities of both agencies matched and led to a strong collaborative effort. The focus, however, remains somewhat different, with the local health department more focused on population health and the hospital emphasizing access to care and treatment concerns. Through the use of Healthy People, these different perspectives can both be honored. Taking as an example the set of diabetes objectives in Healthy People 2020, which range from population health to treatment topics, the advantage of collaboration, so that both needs are met, and the usefulness of Healthy People 2020, which presents the entire range of objectives, becomes clear. A health department top executive in Nebraska commented that, in the lessons learned column, She wished she had simply printed out and handed out all the relevant topic area objectives to her work group members because they created an excellent common vocabulary for the group discussion. Brandon Skidmore is the Deputy Bureau Director at the Kansas Department of Health. Notice his emphasis on how Healthy People supports efforts to work with other agencies. The need for this infrastructure to support the local public health system has probably never been greater. In addition to Kansas, we have been hearing from other states about the usefulness of Healthy People in assessment and planning processes. In Wisconsin, for instance, there is an infrastructure and improvement project. The project is designed towards building the infrastructure to make Wisconsin the healthiest state, strengthening and integrating community health improvement processes and plans. They have been working to create a tool that helps local communities to move from broad priority areas to specific, concrete, doable action plans, creating a tool that, when completed, will meet all of the accreditation requirements for a community health improvement plan. Dr. Dezapian is another member of our advisory group, and as she points out, Healthy People provides support to local health departments regarding the social determinants of health. The new leading health indicator in Healthy People on high school graduation rates is going to give local health departments and community health assessment and planning efforts an important resource in thinking about underlying determinants and broad community strategies to promote the conditions which assure a young person's opportunity to complete high school. An excellent example of how Healthy People support social determinants of health work through community health assessment and planning is happening in Maryland. Local health coalitions are forming or operating in every jurisdiction in the state, thanks in part to direct support from their hospital association. These coalitions, which include local hospitals, are adopting strategies for progress on selected state health improvement planning measures, as well as other local health priorities, including addressing local health disparities. Another example of how Healthy People works to support efforts to combat health disparities is a local health department and hospital collaboration in California. They are having great success with mapping health problems within their jurisdiction to discover the pockets of high health disparity. Kevin Hutchinson, local health department top agency executive and the chair of our advisory group, makes an important connection here between community health assessment and community health improvement planning. The art of the work is tying these two components together so that the community health assessment is not simply an end in itself, a however beautiful document, but a process that feeds into community health improvement efforts. In my opinion, one of the undernoticed and underused aspects of the Healthy People 2020 website currently is the Interventions and Resources tab found within each topic area, and evidence-based practices can be found there. Some of this effort goes beyond the actual resources, though, and becomes a matter of attitude. In a focus group conversation, a representative of a nonprofit hospital commented that hospitals that see community health improvement processes as an opportunity to improve community health rather than an obligation tend to be more successful. A health department executive added that it's important to have the right people in the room who are aware of all the resources available from their organization. It's important to build trust and positive relationships in these partnerships, which does take time. And again, the usefulness of the Healthy People website as a sort of neutral convener can make a difference. Nancy Mills is a local health department top executive in Florida, and many of us facing snow in our forecast this afternoon may wish we could be in Florida today. Nancy emphasizes going beyond the traditional local public health system, and it is a mark of a true participatory process. But the difficulty, as many of us already know, is how time-consuming it can become. Getting to know non-traditional partners and creating with them a vision of how their work ties into public health can be very challenging. Healthy People does help. The coverage of the website, the topic areas, the resources, the interventions, there is something here for everyone, and it can become a common meeting ground.